my approach to how I approach a lip augmentation. So I am a P.A.C.E trainer for Revanesse. We will be using Revanesse products today. We'll go through the line and what your options are in that line. And I am a clinical trainer for THMA, and I'm co-owner and medical director of our clinic with Kelly in Miramichi at Luxe. So why are we so obsessed with lips? So here we have in the second picture, if you don't recognize her in the other three pictures, Angelina Jolie, iconic. But you can see just by changing her lip shape, completely different person. Completely different person. So the shape, the balance, the details of the lips have the power to drastically affect a person's overall look. And I think that's why we're so always really wanting to do the best job that we can, because a lot of people, they're really wanting you to kind of give them that it factor, and you can do that with the lips. In my opinion, lip design is about art. You know, you have to have an artistic eye, you have to have that aesthetic eye. We're all here today, we all have it, but it's also a science. You can't just think, I'm gonna go in there and make these lips pretty and not understand the anatomy and not, in my opinion, have a plan as to how you're going to do that. So you have to have a passion for the art. I have that passion. You have to have respect for the anatomy. You have to have the aesthetic eye. You have to have a creative mind. So one thing about lips, we all know, they're all different. So it is not a cookie cutter approach. It will never work. You've got M-shaped lips, thin lips, gummy smiles, asymmetries, full top lip, lower lip is thinner, vice versa. So you have to have a creative mind, and you have to have an ability to say no to your client. You have to, because your client is looking to you, and it's very easy for them to get skewed in their mind as to what is a normal lip proportion and a normal shape. They just get into that habit of, I go once a year or once, you know, and they just like, they'll come to you and say like, oh, can we do my lips? And like, sometimes it's hard because they're excited. They want you to say yes, because they love that feeling when they get their lips done, but you have to be able to look at them and go, you know what? I think they look perfect. Like, I think they look fine. Honestly, like I had a client the other day and I said, you know what? Your lips are perfect. Buy yourself a little lip plumper. That's all you need. You just need a little hydration. I said, yeah, I could do lip filler here today, but the amount that I'm gonna put in your lips today is not gonna be worth your while in spending that kind of money. Go to Shoppers and get a lip, or use a Revanesse lip plumper, okay? A well-stocked toolbox. You have to have more than one type of technique in your toolbox. So I know a lot of people do the tenting technique. It's very popular. Julie Horn, of course, is iconic for that. And it is an option, but I'm telling you right now, if you are only using tenting as your lip technique, you are doing a disservice to your client, because it has its place. It can achieve amazing things if you know how to use it and when to use it, but it also will cause more inflammation, higher risk of bruising, there'll be more bleeding, it hurts. Like, you can numb them as good as you want. It hurts. When you're along that vermilion border, just inside there's a lot of nerve endings, and it's very painful for the client. And studies do show that it does have a higher risk of migration. So I'm not saying don't use it, but have other tools in the toolbox, okay? So we'll go through that. Ongoing education. It's constantly changing, constantly. 2 years ago, tenting was the thing. There was a phase, I hope to God it's gone, where Russian lips were the thing. And a thorough understanding of your product. So my recommendation is find a product or products and become very, very familiar with how they perform and what you can do with them. And then, you know, kind of branch out and try and see what you like, see what characteristics of particular fillers you like. I have been using Revanesse since I started, and I do find the line to be very well tolerated by clients. It integrates well, there's very low levels of inflammation, and what I like is that it's very predictable. So if I do lips and I bring them back 2 weeks later, I don't wanna be shocked at what I see. I wanna be like, yep, that's what I did, looks good, you know. My approach. So basically the first thing I do is when they come in, they say, I want to get my lips done, is I say, okay, I'm going to give you a mirror. I want you to look in the mirror. Tell me what you like about your lips. Tell me that first. Tell me what you like about your lips. And then tell me what you want to improve with your treatment today. What would you like to see? Okay, and they'll tell you, well, I like my Cupid's bow, or I like my general lip shape, or whatever. It's important to know that. And that will give you clues as to how you're going to formulate your plan. Ask them their fears. So, you know, did you have your lips done before? What was that experience like? You know, maybe it was horrific. Maybe they were bruised all to hell. Maybe they had migration. Maybe they had to get it dissolved. Maybe they had nodules. Maybe it was extremely painful. So ask them their fears and address that. You know, if it's pain, you know, you explain, well, listen, you will feel a little something. I can't guarantee that you won't. Be realistic with them, prepare them, but we're gonna numb you really, really well. Our model is numbing as we speak here, and reassure them. Review their health history, their potential complications. We have done that with our model. Take before pictures, and I recommend taking your before pictures before you put the numbing on, because they're gonna swell with the numbing. So you wanna get your before pictures before you put that on. Numb for at least 15 minutes. I use either an LT or a BLT cream, so you just get that compounded. And I like the LT cream, but I will check on the client after about 5 minutes and say, how are you feeling? Are you feeling numb? And if they should be with these formulations, feeling it at that point. And if they're like, you know, I don't know, yeah, a little bit. I'm like, oh, okay, we're gonna wipe that one off and we're gonna go the BLT. And then 9 times out of 10, they're like, oh yeah, now I'm feeling numb. And it just depends on the person. An antibacterial mouth rinse or your hypochlorous acid. So our model has already rinsed. And get them to do that before you numb them, because it's very hard. They're gonna spit all over themselves and they feel silly. And formulate a plan based on your complete lip assessment. So we're gonna go through what you looked for in your lip assessment and choose your product. So today, within the Revanesse portfolio, we actually have 3 fillers that we could potentially choose from to do your lips. Revanesse has Kiss, Ultra, and Outline, and in that order would be Kiss, Ultra, and Outline, lowest G prime to higher, so very soft, Kiss. Ultra, a little stiffer, going to give you a little bit more of that wow factor, provide a little bit of structure if you need that, and that's part of your plan. And then Outline even more, like you really don't want to go wow, or you really want to get some elevation in the lip or whatever. Outline would be an awesome choice, as well as the vermilion border. If your client mentions they like a crisp border or they want to see that definition, that's what Outline was designed for. Okay, give your client a stress ball or a vibration device, something, give them something. So your lip assessment. A good assessment will form the basis for your treatment plan. So I took of course I took THMA consulting. That provided me a wonderful base, but I really had an interest in lips, so I furthered my education and I did the Tim Pierce 8D lip course. And it's an awesome education. It gives you a lot of resources. I also teach the lip course for THMA, so like I've integrated a lot of that, but with the 8D approach, specifically looking at the volume of the lips, the projection of the lips, the proportion, so you know the perfect ratio, your 1 to 1.618, that depends obviously on ethnicity and patient preference. Some people want more of a 1-to-1 or whatever. Details, so look at their Cupid's bow, look at their vermilion border, look at their filtral columns, definition, angles, so we'll go through that a little bit. There's symmetry. Most people have some asymmetry, so maybe one side is just a little bit lower. We're gonna see what we mean by that. You can even see in that picture, she has one side that kind of slopes down a little bit more on the top lip than the other. Capillary refill. It's a really good thing to integrate prior to doing your lip injections, because if you run into trouble, we had a client that hours and hours. Like actually it was like almost 72 hours. Messaged us and had like sort of these atypical symptoms, brought her in, and we have an ultrasound in our practice, so we were able to really kind of get to the bottom of what was going on. But if you haven't checked your capillary refill beforehand, you're not going to know what is normal for the client. So, I mean, obviously it should be a pretty quick cap refill, but if you do that pre-lip injection, you're going to see if theirs is, you know, maybe theirs is 3 seconds or maybe it's 4 seconds. That's important to know. Venous lakes, do they have any venous lakes? Do they have those Fordyce spots? You guys know what those are, the little white spots? It's important to point that out to the client because when you put filler in their lips, it's gonna bring those spots closer to the surface and they're gonna see them more. So if they didn't see them before, know they had them, they're gonna know once you put the lip filler in and they're gonna say, this wasn't here before. Yes, it was, okay? How much, get them to smile. So, I mean, it's a very different picture when they smile versus when they don't. Do they show a lot of gums? How much of their teeth do you see? You know, if they're not showing a whole lot of teeth with their smile currently, and you go and put all kinds of lip filler in there, they're not gonna like that because their smile's not gonna look right. And of course, their dental health. So I thought we'd talk just a little bit about the aesthetic compartments versus the anatomic compartments. So when we aesthetically think of the lips, we generally think of like those 5 pillows. So 2 on the top, 3 on the bottom. This is the revert, 3 on the top, 2 on the bottom. And that's kind of what you're trying to make nice and full, and you know, you're trying to achieve your aesthetic outcomes, keeping that in mind. Versus anatomically, there's a recent article in June 2024 that Codafana, Julie Horn was in on it as well, and they investigated 20 human cadavers to see whether intralabial compartments exist and to describe their volumes, their location, their boundaries, and dimensions. And what they found was there's actually 24 compartments in the lip. So there's 6 anterior in the top, then you have your muscle, and then underneath the muscle, you've got 6 posterior to that, and the same on the bottom. So 24 compartments altogether. And so they concluded that the volume and the size of each of those 24 lip compartments contribute to the overall appearance and shape of the lips, and they suggest it might be preferable to respect those compartments with your injection approach, okay? So when you think about something like using a cannula, which, by the way, I advocate you all learn how to use a cannula. I know some of you probably weren't taught how to use a cannula in your course, and if that's the case, hit me up and we will teach you how to use a cannula, because it's not my go-to, I will admit, for lips, because I like the precision and what I can accomplish with a needle. But when you need to use a cannula, for example, dissolving, makes your client's life so much better and makes your job much easier if you can dissolve with a cannula. Because dissolving is not pleasant for the client, it stings, they get a lot of swelling, you don't want to be poke, 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 poke all the time kind of thing. You want to be able to get in there with a cannula. But when you use a cannula, in regards to all those compartments, you have to understand that there's little septations that divide those departments. And when you're going in with a cannula, you feel that. You feel, oh, getting through something. Getting through another, those are those septations, okay? So this diagram just shows you where the compartments are. Again, 6 anterior to the muscle and then 6 posterior on both top and bottom. So in the bottom picture, you can see in the purple, there's your anterior compartment. The red line would be your muscle, and then you would have your posterior compartment in cross-section view. So our model, so Sarah is our lovely model. This is a picture of her lips. She has no significant medical history. She's a newbie to filler, so thank you, Sarah, for allowing us to inject you on stage. She does have a cold sore history. That's important to know because, of course, you want to put them on an antiviral prophylactically, because they might say to you, I haven't had a cold sore in 10 years. And I say, well, this is the time you're gonna get it probably. So we're gonna put you on an antiviral. And the other thing is, if they say, yeah, I get cold sores quite a bit, cannula probably not gonna be your best option, because you're gonna have a lot of scar tissue there, it's gonna be uncomfortable for the patient, and you're not gonna get a great result. Okay, so She mentioned that she has a thin upper lip when she smiles, so that was something that came out in the assessment, and you wouldn't know that just by looking, but when she smiles, she has a very active orbicularis oris muscle, pulls her lip up and under. And she mentions that she likes the definition in her lips. She mentioned that she likes her cupid's bow. She would like to see a fuller top lip. And she also said, I need to numb a long time. So she has been numbing. So that tells me she has a fear of pain. Okay, so what do I see when I look at her lips? So if we kind of look from a few different perspectives, in the center picture, I kind of pointed out what I see. So those dotted lines coming down, that's your lip angles. So it kind of runs from the nose down to the GK point, and then it's gonna come down to the lower lip. That's where you wanna see those angles and kind of maintain that. Hers on one side is a little off because where that pink arrow is, her cupid's bow is just a smidge short than the other one. So we'll try and kind of bring that up. We can see that, you see where I have the white circle, that pillow, that area is a little deficient. So I wouldn't say she's a big M-shaped lip, but she does have characteristics of an M shape, so the center tubercle is a little more dominant than laterally. So we'll adjust that for symmetry. And then I would say for her top lip, she's thinner laterally, so we will try and provide a little bit more elevation and height in that lip to give her a fuller appearance. Bottom lip looks really good. I think I would just probably give her a little bit on the outer corners just for hydration and just to kind of tie the look all together. We can also see that side on, she could use some projection. So if you were to kind of do that rickets line, you could see that she's going to be back quite a ways. Both top and bottom lip are going to be back. Ideally, you want to see that top lip project about 2 millimeters from the bottom, not the reverse, okay? And then you can see when she's smiling, obviously toxin would be an awesome option for her as well. It would probably make her result even better. But of course, when you do your toxin, it's not gonna last as long, and she's gonna have to keep coming back every 5-6 weeks or so. Yes, yes, and I did mean to mention that too, yes. She has one oral commissure that's kind of downturned a little bit. Okay, so our plan. So we're gonna add some volume and projection to the upper lip, and we're gonna use linear fanning. You could say linear fanning, you could say sculpting. We're gonna correct the deficiency in the upper pillows, probably with linear fanning again. You could use a 4 millimeter technique, we'll go through that. We're gonna provide balance and hydration to her lower lip, also linear fanning. We're gonna raise the low side of her cupid's bow, and it's kind of like a little lollipop injection, we'll go through that. Reinforce definition to the vermilion border, so we could do some linear strips to keep her border crisp. She likes kind of a more defined look. And assess whether slight elevation is needed to her upper lip. So if we need to, after we do all that, then maybe I'll say, okay, I am gonna tint just a little bit. But it's not my go-to anymore. It was, but it's not anymore, okay? Provide support to the weak oral commissure, okay. All right, choose your product. So again, these are our 3 options. Kiss, I would use Kiss in somebody that mentions they want to stay very natural looking. It's not for the person that wants crisp borders. It's a really good option for an aging lip, and it's a good option for someone that has loose lip tissue. That's another thing you want to assess when you look at your client. Is the lip tissue loose or is it firm? When it's loose and you pull the tissue away from the lip, you're going to see all that extra space in there. If you go with a product that is too stiff in that type of lip, you're gonna end up with lumps, because what's gonna happen is it may look okay on a relaxed pose, but when they smile, you're gonna see where the filler is and where it's attracted water, and then you're gonna see nothing, and then you're gonna see a bump, and then you're gonna see nothing, and they're gonna hate it. But if you use something like Kiss, it's a little more hydrophilic. It's gonna fill up that space nice and just give you a nice soft look, and it's very forgivable. You can mold it and spread it around, it's nice. For her today, I think we're going to use Ultra. It's a little more, it's got a little bit more G prime, a little less hydrophilic, so still good for definition and elevation if we want to do that. And we'll see time-wise where we're at. Maybe we could use a little bit of outline in her vermilion border. All right, and then we're just gonna go through real quick. So these are the techniques that I mentioned. So linear fanning, sculpting technique, and this is again a picture from Tim Pierce's 8D textbook. So it's good because it really shows you, where the arteries should be. We know 80% of the time it should be behind the muscle, but not always. If you do a cadaver lab, you'll probably see one of these times that it's not. It's either in the muscle or, God forbid, ahead of the muscle. But with your linear fanning, it's just as you see those white strips, and you can do like a little lollipop injection at the end of your strip if you want to add definition or increase your angles. And about 0.05 mil per strip. Sometimes I do a little less than that, it just depends. And you can stack them to get more height, and we'll be doing that today. 4 millimeter technique is another technique you can use, and that's just, you can actually use a little 4 millimeter needle that you would use like for PRP scalp. And that's just tiny little boluses, and the beauty of it is the little needle should be at a much more shallow depth than where the artery should be, okay? Tenting, probably we're all familiar with tenting, and there's some various tweaks to that, but basically you're gonna go just inside the vermilion border and never through the vermilion border. You're setting yourself up for migration. And you're gonna advance your needle down to the wet-dry border, lift it up, it should blanch, you should never see the gray. If you do, you're gonna see visible filler after the fact, they're not gonna like that. And I do leave the little bleb of filler when I'm drawing my needle out. You can see in that diagram that the other thing about tenting is depending on your lip. If you have someone with a very flat lip or an older lip, anatomically, their artery is going to be closer than, even if it lies behind the muscle, it's going to be closer. So when you're going in with your needle at the regular angle you're used to going at in a thinner lip or an aged lip, you're actually much closer than the artery than you would be with someone with a full lip, because the angle is totally different. So you can kind of see how that would be in that picture. Okay, so then you work your magic. So know what to do in case of an emergency, of course. Give yourself enough time, especially when you're starting out. Like when we started out, we booked an hour and a half to do lips for everybody. Because the last thing I wanted was, you never know what's gonna happen. We've had patients throw up in the chair. We've had, vasovagal, and you could run into a problem where you're like, oh my God, this is just not working for me kind of thing. You start to sweat and your next client's coming. Give yourself time. Check in on your patient during the procedure. So like, how you doing? How's the pain? You can tell if they're in pain, they'll wince, they'll jump a little bit. Take your after pictures, provide a clean lip balm, tell them or give them. We actually order from a company and we get our lip balms made, and they're all natural with arnica and coconut oil and all kinds of good stuff. And we give one to every client that gets their lips done. Revaness also has one. We'll give her one today, but the purpose of that is you don't want them to introduce any bacteria from an open chapstick or lipstick, because that's what they want to do, right? They want to go home and put that lipstick on. They want to assess the situation, but no, you don't want them to do that. Ice pack, aftercare instructions, and make sure they know how to contact you if there's a concern. Like if someone is getting their lips done that's what we tell our clients, look, if you go out of town and you get your lips done somewhere else, who is going to look after you if it's Friday night and you're like, this is not right? Who are you going to call? So make yourself accessible. I give my clients my cell phone number. We're in a small city, and I'm just like, listen, if you have any questions, you just text me, let me decide. Give yourself a big pat on the back. Giving someone a newfound confidence is priceless. We all love that feeling when you give the client the mirror and they're like, oh my God. It is the best feeling. And for me, going through X amount of years in a stagnant workplace where I felt completely unmotivated, it is the best reward. So, without further ado, here's the lovely Sarah. She is, how numb are we?
Very.
Very numb.
About 10 minutes, but Barbara said that she would give you 15
Okay.
minutes of her time.
Okay, perfect. Okay.
And Corey's going to help you, so he'll
Okay. Okay. I'm pretty quick anyway. You're going to be shocked. You don't need that?
No.
Okay.
Whatever I think is best for you.
Yeah, we'll put that away. Yep. Perfect. Huh? Okay, no, love it. Okay, so first we're just going to give her a real good cleanse. Get all that numbing off. Okay. Yeah, she's rinsed already. Okay. So all the good makeup coming off. Alrighty. Now, something that I like to do is I like to landmark my lips. Need a mask. Okay. Hopefully I don't fog up. Can you guys still hear me okay? Yeah? Okay. All right. So I like to landmark my lips. I like to have a plan. I never like to go in willy-nilly. So what I do is I just give a little line here at the top of the Cupid's bow. And then same thing on the other side, and then look my way. And then we're gonna go the width of the alar base. That's where the fullness of the lip should be, here and here. So just some little marks. Drop it down, same thing on the bottom, and then I do the center. Especially if you get in with a cannula, you're gonna wanna have landmarks, because when you're in with a cannula, everything's kind of gonna be sort of blurry and you're not gonna know exactly where you are. Okay, so product. Perfect. Ultra? Wicked. Okay. Alrighty. Do you want a stress ball to hold on to? Oh, you got it. Oh my God, she's so prepared. All right, we're gonna move that. So, I work on quadrants, so I'll do the top lip this side, then I'll do the top lip that side, and then I'll do the same for the bottom. And I usually put about 0.1 per quadrant to start out in total, or close to that. Okay. So, actually, I'm gonna switch because I always start on the side that needs correction more. So this is her low side here. So I'm just gonna stabilize the lip. Gonna be a poke, 1, 2, 3. Okay. So you can see she's blanching there. We're at the right depth, ahead of the muscle. You okay? And we're just gonna go like that. And then I'm almost out, but not quite. I'm just gonna redirect, drop it a little, and leave a little strip and a little bleb. And then I just give it a little rub. Perfect. Okay, how was that? Good. Not too bad? Okay, perfect. Okay. So I'm just gonna back up a little bit. Something I recommend, if you're not used to the filler that you're using or you're trying a filler for the first time, is express a little bit onto like a 2x2 or something like that, just so you can get an idea of the extrusion force, because you don't want to experiment when you're in the lip and push something like Kiss too much and you're like, oh, uh-oh. And then the client goes, oh, what? Oh no, it's all good. Okay. Okay, look my way. Perfect. I'm gonna give her a little bit more here. I'm gonna go a little closer to her vermilion border just to add definition. So right up to the Cupid's bow. And there we go. And one more here. Perfect. I use the needle that comes with the filler. So like, trust me, I was there as well. You all want to use the tiny, tiny little needle, or you want to backfill. Get used to using the needle that comes with the filler. The filler was designed to be used with that specific needle. Your client is not going to bleed that much more. I don't notice an increase in bruising. And if they're numb enough, it's fine. So I always use the needle now that comes with your filler. Okay, so we are now at, I can barely see here. Yeah, just a little past 1.1. Revanesse gives you 1.2 in a syringe. Okay, so we're gonna do the same thing over here. 1, 2, 3. And drop that. So this is your linear fanning or sculpting. It's gonna give you projection, fullness. And if you go up close to the vermilion border, it will give you a little bit of elevation and crisp up that border without having to do the tenting. Okay, look my way. Perfect. So this area here was where she had the little deficiency. It's better already, but I'm gonna give just a smidge more. So we're a little closer to the wet-dry border, but always above. Okay. Okay, take that. Now we're going to move to the bottom. She's going to have a bleeder here a little bit. Yeah, right that real spot right, oh, here like that. Yeah. Okay. Same thing on the bottom. Sometimes I find the bottom hurts more for the client. Do you find that, Sarah?
Mm-hmm.
Yeah, she's like, Now her bottom is bigger than her top, so I'm not gonna give that much on the bottom. I'm really just kind of providing hydration, because if you just do the top and you don't do the bottom, you can tell, because like that bottom tissue will be kind of, I don't know, it looks kind of wrinkly. The top lip where it's injected will pull water in, it looks smoother, and it's like got a different color almost to it. So even if I'm not trying to provide much volume, I will give a little bit just to hydrate. Perfect. Okay. And poke. So with a lot of these injections, she's not bleeding. You're gonna get a few that bleed, obviously, but for the most part, pretty good. Okay, now look this way. I almost need a stool. This looks good, smile for me. Oh yeah, that looks better, okay. So she's pretty good there now. I am gonna give her just a little bit at the angles here. So what I'm gonna do is I'm gonna go, so if we draw a line from here down to the Cupid's bow and then come down, right about here and right about here is where her bottom lip angle should be. So I'm just gonna give her like a little lollipop. And then redirect, and then a little bolus, and then just kind of give it a little squeeze. Perfect. Do the same thing on the other side, and then we'll do our Cupid's bow and she'll be done. So coming down here. Oop. Perfect. Okay. Look my way. Looks good. Okay, so now, this is the low Cupid's bow here. So what I'm gonna do is I'm going right up into the tip of the Cupid's bow. You can see my needle where it's blanching. And I'm gonna just give her a little bolus, like tiny little bolus. And then on the way out, a little bit. And that's gonna bring her right up on that side. And then we can do the same on the other side, but less so, obviously, because we don't wanna chase our tail, but just to give her that definition that she likes. She likes her Cupid's bow, so. Okay, smile. Perfect, okay. I think we're good. I think one more on that side and then we're done. And then we'll clean her off. So how you doing? Good?
Yeah.
Okay. Okay, alrighty. Okay, and you can tell them if they're swellers, you'll know, like they're gonna swell up really quickly. I often tell them to go home and take a little bit of Reactin. It does help take the swelling down pretty quickly. Okay, all right, okay. So I also tell her, we worked a lot more on your top lip than your bottom, so you're gonna be more swollen. So when you first look, you're gonna be like, oh, my top lip is so big. Trust me, trust the process. Tell your clients it's gonna change day by day. It's gonna come down, and in 3, 4, 5 days, it's gonna be perfect. But you have to tell them and warn them that they're gonna go through this transition where they're gonna wake up in the morning and be like, oh my God, what did I do? Like, chill, it's gonna come down, put some ice on it. As the day goes on, it gets better. But I do tell my clients about 2 full weeks. And I have not used a full syringe, so I literally have 0.4 left in the syringe. So you really don't need to use a lot to accomplish what you're trying to. Yeah. Perfect, little arnica. So we'll use a little arnica to just kind of smooth things out. I'm not vigorous when I massage, but I'm just mainly trying to see if there's any palpable lumps or anything like that that needs a little. And your clients shouldn't have to massage, but I do tell them after 72 hours if there's an area where you notice like it's quite obvious, you can give it a gentle massage, and then we'll see them back at 2 weeks and address that at the time if we need to. There we go. Okay, let's sit you up. Okay, and smile. So smile, yeah, let's see the smile. Yeah, yeah, yeah. So less gum in her smile. I think a lip flip would also help. But yeah, we didn't have to do any tenting with her. I think that's going to be good. I'm going to get you to hold that on your lips.